Welcome back to Dr. Boms YouTube channel. So in our last video on hypertension, we explored how hypertension can be managed and home-based remedies as well, healthy diets, and then reducing stress, exercising, and all lots, and also taking prescribed medications regularly and not skipping the medications as prescribed by your doctor. Today we are taking it a step further by tackling hypertensive emergencies when high blood pressure becomes life-threatening. When it is an emergency, and understanding what your blood pressure and readings mean for your health. So please stick with us to learn how to act fast in times of emergencies. And if you are here, make sure to hit the subscribe button, like and share this video. Please, let's continue to grow our community and smashing that. Ensure that we also get the 1,000 subscriber goal together, because together we win, and together we move. We are moving forward ever. Imagine this: you or your loved one suddenly experiences chest pain, shortness of breath, or even confusion. What would you do? This could be signs of hypertensive crisis, and knowing the right steps can save lives. Sometimes you don't even have any of these symptoms because, like I said, hypertension is a silent killer. That is why we encourage people to regularly check their blood pressures and also eat healthy, and also take in a lot of water regularly. Daily taking at least 3 liters of water, starting with the first glass or cup of water in the morning. Normal temperature water. Don't go for cold water, just normal room temperature water first thing in the morning. Like I earlier mentioned, that we always usually say that high blood pressure, the normal should be below 120/80. When we say 120/80, we are talking about the systolic and diastolic readings. So the systolic means how much your heart is able to contract, the muscles contract to pump blood to your body, and then that's the upper value, that is the systolic reading. How much is your heart able to pump blood so that it can circulate around the body, which should usually be below 120/80, or we say sometimes it should be around 120/80. Then we talk about the lower value, that is the diastolic. It means tells us the ability of your heart to relax, for it to be filled in so that it can pump blood to your body. Usually in pregnancy or for pregnant patients, we are usually interested in the diastolic, how much the woman's blood pressure, how much how much the heart is able to relax to allow blood go in to the heart for adequate blood circulation. Elevated high blood pressure, we say, is when the blood pressure is now between 120 and 129. That is the systolic, and for the diastolic, less than 80, we say the person is pre-hypertensive or in pre-hypertensive stage. When the person is now having a reading of systolic, having a systolic reading of between 130 to 139, we say the person is now, and then so when a person is having a systolic value between 130 to 139 and diastolic value between 80 and 89, that means the person is in hypertensive stage 1. The person has been diagnosed of hypertension. And usually when the diagnosis of hypertension is after 2 readings of the blood pressure monitoring, the patient has to be checked twice on sometimes different occasions, just to be double sure that this is actually the current reading of this patient. Then afterwards, and other investigations here and there and symptoms and all that, the diagnosis of hypertension is made and the patient is placed on medications. For instance, amlodipine, lisinopril, calcium, say calcium channel blockers, as one of them is lisinopril, amlodipine, nifedipine. We have quite a number of them. The thiazides, the hydrochlorothiazide, the thiazides, and just to mention but a few. So that is for hypertension stage 1. So hypertension stage 2 is when the person is having high blood pressure above 140 for systolic and diastolic 90 mmHg. Then we say the person is what? Having hypertension stage 2. Then hypertensive crisis, we say is when the systolic pressure is above 180 over 120 millimeters of mercury. That person requires immediate medical attention. A blood pressure above 180 over 120 is a hypertensive emergency, and such a patient requires immediate medical attention. So hypertensive crisis, these are some of the symptoms. Apart from the blood pressure reading very high, like I've mentioned, the patient may start having severe headaches, chest pain, blurred vision, difficulty breathing, or even confusion. Other signs of hypertensive crisis can be low blood pressure. Patients might be dizzy, having fainting spells, fatigue, cold, clammy skin, extremities as well, cold and clammy, low blood pressure, dizziness, fainting, fatigue. These are also signs of hypertensive crisis. So hypertensive crisis is not only when the blood pressure is high. The person can be having hypertensive crisis also when the blood pressure is low. Yes. So a sudden and extreme rise. So we talk about hypertensive emergency. It is a sudden and extreme rise in blood pressure that causes damage to organs. So in this case now, there's organ failure, multiple organ failure, like the heart, the brain, or kidneys. Sudden and extreme rise in blood pressure. This causes damage to organs like the heart of the person, the brain, or even kidneys. Like we already said, patients with condition like this need immediate medical attention. Thank you very much for listening. I hope this video made sense to you, and we hope you apply everything you hear from us so that together we can all have healthy lives and live longer and stay healthier. Thank you very much and have a great day.